Hello. We're starting our next session. The speaker is Dobri Kiprov. We are actually extending the analogy of the seed and the soil that Siri talked about earlier. So Dobri is an expert in therapeutic plasma exchange, and he's conducted a number of clinical trials, clinical studies in humans, and also he's on a number of international societies of apheresis and other plasma exchange bodies across America. Over to you, Dobri.
Good afternoon, and thank you, Jody. Thank you, Aubrey, for inviting me. It was nice to be here because I already learned a lot of things. So hopefully I can give you some insights about plasmapheresis. I know that this is not a common word, so I'm going to spend some time explaining where it comes from and what it means and how we use it today. From ancient time, people believed that there are substances in the blood that actually contribute to the character of a person and the demeanor of a people. They also believed that there are substances in the blood that cause diseases. They called these substances bad humors. And in order to remove them, they did all kinds of bad things. So bloodletting was very common. It was performed by barbers at the time, and despite the fact that it was a very brutal procedure, it survived till the end of the 19th century. Today, we use a much more sophisticated means to remove substances from the blood, and we call this apheresis, which is a Greek word that means to take away. So plasmapheresis means to take away the plasma. And plasma usually contains these bad substances. Now we don't call them bad humors today, we call them autoantibodies, circulating immune complexes, cryoglobulins, low-density lipoprotein, etc. And we can use this procedure to separate the different components of the blood. There are several FDA-approved pieces of equipment available to us today. We use primarily cell separators as there are two technologies that are, I'm told that the pointer doesn't work, but on the top there that you can see that it is a filtration or membrane separation and centrifugal preparations. The membrane separation is provided with the membranes with the small pores that can allow fibrinogen, larger molecules in the plasma to pass through, but does not allow the smallest cell component, which is platelets, to pass through. In the United States, this is how it looks like. Membrane separation. It's not very popular in the United States. We don't have good big equipment to do that. We use centrifugal devices, and as you can see here, we can remove any possible cells, so plasma, platelets, white cells, and red cells. So this gives us an opportunity to remove not only blood components that cause diseases and are in the plasma, but also gives us the opportunity to collect stem cells. As you heard over the last hour here, a lot about stem cells. There are new technologies today, CRISPR and CAR T cells, CAR NK cells, and so forth. Without this technology, these new techniques will not be possible. And this is how a plasmapheresis procedure looks like.
Therapeutic plasma exchange, or TPE, refers to a specialized medical procedure in which blood separation technology is used to remove abnormal plasma constituents. Whole blood is removed from the patient into a blood cell separator, which utilizes centrifugal forces to separate whole blood into its individual components: plasma, platelets, white blood cells, and red blood cells. Plasma can be removed and replaced with physiologic fluids to treat relatively uncommon but usually life-threatening diseases.
Well, according to the Journal of Clinical Apheresis, which is published every 3 years with the clinical applications for apheresis, there are about 100 diseases that are treated today. These diseases are usually not common and usually very, very severe in terms of the livelihood of the patients. The breakthrough of plasmapheresis came in the early 80s by publication from Canada describing the use of plasmapheresis in a controlled clinical trial versus placebo in thrombotic thrombocytopenia purpura. TTP is a microangiopathy, and it's not very common, but it's deadly. It used to kill almost 100% of its victims until plasma exchange came aboard, and now the mortality rate is less than 10%. Now, how does this have to do with rejuvenation in longevity and the purpose of this conference? I got associated with Michael and Irina Comboy at that time, 2005. They were in Stanford. Today they are in Berkeley. And they used parabiosis as an experimental model to study aging. So parabiosis is basically the combined circulation of two mice, obviously genetically identical, and this creates a single circulation through both mice. And what they observed was that the old mouse became younger and the young mouse became older. Our further experiments with them, and as well as in humans, indicates that outside parabiosis, if you only infuse blood, the old mouse will not become younger, but the young mouse becomes older, which indicates that there are substances, as the ancients used to teach us, that are bad for your health and for aging, apparently. However, the fountain of youth, which was hoped to be the case here, did not pan out. There's nothing that we could find in the young plasma that can rejuvenate. However, the extrapolation from these experiments immediately was that there is something in young blood that causes this rejuvenation. And you can imagine that millions of older people, certainly in the United States, flooded the blood banks and the plasma centers and wanted young plasma to be infused in them. I'll show you in a second why I'm against that. The problem is that you're not a mouse, and we try to create a model that will translate parabiosis into humans. In 2005, I published the hypothesis of how this can be done, and I already showed you that. So if you have an older person who wants to get younger through parabiosis, if you will, we can take her blood out. Instead of connecting her to a younger person, we connect her to a machine, separate the plasma, throw the plasma away. Obviously, the question is, what do we put back? And naturally, people will say, put fresh frozen plasma from a young person. First of all, logistically, this is close to impossible because there's so much young blood available, and there are regulations in the blood banking industry that are unsurmountable. Besides that, I've been using fresh frozen plasma for very sick people, including TTP that I showed you, for the last 30 years. And the side effects of fresh frozen plasma can be really devastating, including death. So this is not advisable, and although it was done, and I'm sure it's still being done, I assure you, don't do that. We have cases that resulted in death, and this came to the attention of the FDA, and the FDA now does not allow this practice. What I proposed at the time, and we still use that, is 5% albumin, which is the major portion of the protein portion of the plasma, of the human plasma. It's a pharmaceutical product. It's no blood anymore, so it's not considered a blood product, but a pharmaceutical product. And it's very safe. In addition to that, albumin can be very useful for patients who look for rejuvenation. It's anti-inflammatory, it's the most powerful antioxidant in the body, and it's immunomodulatory as well. Now, interestingly enough, over the last few years, we have learned, we first published that, but many others have done other experiments as well, to show that plasmapheresis not only removes substances from the blood, but has very profound immunomodulatory effects, which I'll show here in a second. This is comparison of the side effects of plasma exchange performed in different hospitals in Europe and in Japan and in the United States. As you can see, the side effects vary from a place to place. The orange bars represent use of FFP. The blue bars, 5% albumin. As you can see, in some institutions, the side effects are pretty high, and others no. It's very important that the procedure is performed by experienced personnel who knows really what you're doing. So the adverse reactions, in our experience, have been minimal. We performed an Alzheimer study, which I will talk about in a second. We performed 4,000 procedures with side effects about 10%. Another study is being done now in Barcelona. They have enrolled 1,300 procedures, have 3%. And in our own experience over the last few years, we have performed 1,200 procedures, and really we not have seen any side effects. So this brings us to a point that I call a paradigm shift in therapeutic apheresis, where we can treat diseases that do not require ICU and hospital setting, to take them out of the ICU, which is enormously expensive, as you all know, and take this procedure in the outpatient setting, which is much more less expensive, and it is very benign. So how does this affect aging and what we know about aging? There is something that there is a new word, and I'm sure you know it. It's called exposome, and that is what we are encountering on our. So it's the environment, it's diet and physical activity, chronic inflammation through chronic exposure to infectious agents and so forth. All these things here on the left-hand side everything that we're exposed to, including sleeping habits and so forth, exposes to inflammation and cause chronic inflammation. And chronic inflammation, it leads to aging. Chronic inflammation leads to very serious diseases that usually cause death. This is a very poignant publication. David Furman and his colleagues from Stanford published a few years back. And what they found was that chronic inflammation increases with aging. Why is this important? It is important because, as you can see here, these diseases are primarily diseases of older people. They occur after the age of 60 and increase in frequency as people get older. Think about it. There's nobody who dies of old age, very rare. People die of diseases, and these are the most common diseases that lead to death with older individuals. So if we can intervene earlier, in the mid-50s, early 60s, to prevent the chronic inflammation and prevent some of these diseases, we will prolong life. So the pathophysiology of aging that we know so far, we're still learning, and there'll be differences of opinion here, but what we know now is that there is the process called inflammaging. As I said, chronic aging, inflammation is very important. Immunosenescence, where the phenotype of immunocompetent cells changes over time, which also has been published. And there is cellular senescence with the production of SASP, senescence-associated secretory phenotype, which is very toxic. It contains cytokines and chemokines. It so happens that inflammaging can be affected by plasmapheresis, one of the most anti-inflammatory interventions. Cellular senescence, we remove SASP, and immunosenescence, as I'll show you, is affected by plasmapheresis as well. So the old milieu, the blood circulating in an older people obviously has a variety of substances that cause chronic inflammation and therefore aging. And after plasma exchange, this systemic milieu is rejuvenated. It contains primarily anti-inflammatory and antioxidant 5% albumin. So here I'll show some of our experiments. The majority of the experiments that we have done so far are in collaboration with the convoys from the University of Berkeley, and currently I'm serving as a visiting scientist for the Buck Institute. So we perform many of these studies in collaboration with probably some of the best labs in the world. And here, this thing is not working, but on the left-hand side of the upper graph, this is a proteomic study, you can see that there are quite a few red and yellow dots. And if you look at the very far side, there is only blue. So the red and yellow dots are components associated with aging. And as we go through the procedures, R1, R2, and so forth, they disappear so that the proteome becomes younger. Basically, is very much what you'd expect in a younger individual. The same is true for the changes that occurred in the phenotype of immunocompetent cells. As you can see here, there is a increase in CD3, CD4, CD8, and so forth. At the same time, there is a decrease in pro-inflammatory cells. And last but not least, there is a decrease in DNA damage, which prolongs the biologic age. So in summary, therapeutic apheresis removes the various factors contributing to chronic inflammation. It also affects the epigenetic changes of the individual, and overall it creates a very healthy environment for an older individual. So all our experiments so far have been uncontrolled, and we decided to do a controlled clinical trial to do that, to make sure that what we found in the uncontrolled trials is relevant and scientifically proven. As you can see here, this is the patient sitting in a chair, and plasmapheresis is being performed, but she doesn't know whether this is true or not true because she's separated from the machine and the operator with a curtain. We have 4 treatment groups, and so far we have performed 25% of the procedures. This is the other side of the curtain where the machine is there with the operators and the patient doesn't know. So this is the sham pheresis or placebo-controlled pheresis. Let me tell you, this is not an easy task to do. Technically, it's not easy to perform, and also has an impact on the patient and the nurses who perform it. This is a very early study. We do a test called Up and Go, and this is reversed here. This is actually the grip study, or the blue is the real patients, and the shoot is the sham. It's not the Up and Go test, but it's the grip test. We measure grip test. As you can see here, is a pretty different, quite different, and this is the Up and Go, where the blue line is decrease of the speed. We measure them in seconds, so the time is less for a certain period of distance that the persons who should have. So here again is the association with age and chronic inflammatory diseases. And as you all know, one of the most common diseases associated with aging is Alzheimer's disease. And Alzheimer's disease is very complicated, and it has circulating amyloid in the blood. It's related to infections. It has p-tau and neuroinflammation and so forth. So it's a very complicated disease, but certainly could benefit from plasma exchange. So basically this is another proteomic analysis, and all the patients who have Alzheimer's disease are in the right-hand side group. As you can see, the proteomic analysis clearly indicates that there are different proteomes in the older group. And since 2004, we have been collaborating with a very capable group in Barcelona, Spain, to organize a clinical trial, apheresis trial. It was sponsored by Grifols, a company that deals with plasma collection and production of albumin and IVIG. All these years we were trying to do it. We did several trials, but the last trial was completed in 2018. Unfortunately, it was published right in the middle of the pandemic, and this was a problem, of course. But and here the primary points we got patients who were involved in the trial were either with mild or it's fine. Patients were either with a mild or moderately severe disease. And as you can see on the pyramid, we were able to show that treated patients did not progress, but the placebo patients did progress, and the difference is statistically significant. The secondary endpoints were physiologic, and patients either didn't progress or showed benefit for that. And I don't know if you have seen patients with Alzheimer's disease and their relatives, but it's a very unpleasant and sad story. And we're able now to treat some patients, and they live a relatively normal life. I don't say that they are cured, but they do not progress, and they have relatively normal life with their families. I'll stop here and see if you have any questions. Thank you.